everybody. My name is Corey Lewis. I'm the health coach here at Broadlawns Medical Center in the Primary Care Clinic. I have with me today Dr. Brian Gallagher of the Urology Center of Iowa. Thank you for being with us today. If you want to just introduce yourself, that'd be great.
Yep, my name is Dr. Gallagher from the Urology Center of Iowa. I'm very happy to be here.
Awesome. Well, I would love to learn more about, prostate cancer awareness. Can you tell us, what is prostate cancer?
Prostate cancer, or any cancer for that matter, is when the particular organ, a cell in that particular organ, begins to multiply or divide more rapidly than it should, and it continues to grow and expand outside of that organ, in this case the prostate.
Right. So what are some of the risk factors of developing prostate cancer?
Some of the biggest risk factors for developing prostate cancer are age. So the vast majority of men are over the age of 60 that are diagnosed, but there are men that are younger than that. So age is one, your family history is another, and urinary symptoms also can contribute, although most men are diagnosed through PSA screening or screening for prostate cancer rather than through their symptoms.
Right. So, a lot of men, the majority of them don't really see signs, when they're going about. What are some things they should be mindful of, or what they should be thinking about when, wanting to screen for prostate cancer? Yeah.
So the vast majority of men don't have symptoms. So the biggest thing is to be screened and actually go through the process of being screened. That's part of the reason why we're setting up this free screening event. But the bottom line is some of the symptoms that you can see that would point us in the direction of possibility of prostate cancer, or you having prostate cancer, would be weakening of your stream, blood in the urine, unintentional weight loss, night sweats, any of those type of symptoms, or any change in your urinary symptoms would be a reason to come see a urologist.
Right. I think it's very important for, specifically, you can speak on this, African American men who are at higher risk. Can you talk a little bit why, for one, why is that important for African American men to get this screening? And for two, who else should be thinking about coming to the screening in next month? Yeah.
So 1 in every 6 African American men will be diagnosed with prostate cancer in their lifetime. So it's very prevalent or very common. Unfortunately, it's also known to be much more aggressive in African American men. African American men are twice as likely as Caucasian men to die of the disease, because they tend to get the disease a little bit later, or diagnosed, I should say, a little bit later in the disease process, and it also tends to be a little bit more aggressive. So it's very important that you're diligent and make sure to follow up with your primary care physician and/or urologist to be screened.
Right, and the cool thing is that we have this free prostate screening June 8th and June 22nd from 5 to 7. So this would be a great opportunity for somebody to come get screened and learn about their body and see where they're at.
Yeah, I agree. This is an excellent opportunity for men of all ages and races, for that matter, to be screened. It's a free screening. It's June 8th, and there's another one on June 22nd from 5 to 7 o'clock at Broadlawns Medical Center. It'll be pretty quick, I think, with regards to the procedure itself. We'll draw some blood from you, and then you'll be on your way.
Right. How long does it typically take for someone to get those results back?
Yeah, we should have those results within 3 to 5 days.
Awesome. Well, Dr. Brian Gallagher, thank you so much for your time. And everybody, if you're interested, the free prostate screening, again, June 8th, Tuesday, June 22nd from 5 to 7 here at Broadlawns Medical Center.
Yeah, and I just wanted to throw in there that, as far as who should be screened, any man age 50 and older are more than welcome to come. Those patients are African American men, for that matter, at the age of 45, or Caucasian or white men with a first degree relative from 45 to 50, and then African American men with 2 first degree relatives, so like a brother and a father. Even at the age of 40 and on up, we'd be happy to screen. So anybody above 50, and then if higher risk factors are those patients that have first degree relatives, even younger than that at the age of 45 and 40 as discussed.
Awesome. That's good information. Thank you so much.
Thanks. Appreciate it.